Hey, I'm Jason Pozner from Boca Raton, Florida, and for the Plastic Surgery Channel, we have another No Spin Live. We have our two wonderful experts today, Dr. Carolyn Glicksman, who I've known for far too long. We were training together from New Jersey, and Kristi Hustak from Houston, Texas. So two wonderful places. So today we have two very cool stories. You know, the first story has been hitting the news is about Linda Evangelista and her woes with her CoolSculpting and the attempts she's had to fix this. So we're going to start with that, and we're going to start with Dr. Hustak talking about what you know about this story.
Yeah, hot story right now for sure. This is the story about CoolSculpting or cryolipolysis. So freezing fat that's really stubborn, and then your body comes in and kind of degrades that, and you lose about 25% permanent fat reduction in whatever area is treated. You need a couple treatments kind of thing. This non-surgical device is one of the most popular non-surgical treatments across the board, right? So super popular. We've been doing it for years. What we're starting to see, and we saw it a little bit in the beginning, it's just exploded because it's gotten rarely popular and a lot of people have used it, is the opposite happening, right? Where you get something called PAH, so paradoxical fat hypertrophy. And that's what kind of this story is about is, this non-surgical device, you're freezing the fat away, but the opposite happens to some people. And how do we treat that? And that's kind of what this lawsuit's all about. So it's an interesting story, and certainly most of us have seen it in our practice. What about you, Carolyn? Have you seen this?
No, I've been doing CoolSculpting probably in my office for about 8 years, 7 to 8 years, or a little bit longer. I mean, when it first came out, I don't even remember when I got my first machine. I have this newer machine now as well. But I can tell you that we've known it's out there. We have seen it in the informed consent. And then you started, my biggest question in any type of litigation like this is basically, who's doing the treatments? What is their training? When do they stop? At what point did she have a problem and not recognize that it was a problem and keep going to the same person? So, I mean, there are extremes of any complication, but of course you could throw the company and the machine under the bus. I love CoolSculpting. I would do every inch of my body every year if I could keep doing CoolSculpting, because it just fights those little problem spots, and I'm all of 92 pounds. But CoolSculpting, basically, when it comes down to the training, who's doing it, who's the person who's using the machine and putting it on you, that's my question. When there's so many meta spas and these places, and there's what they basically call, some sort of comparative negligence. Was she in part in this lawsuit? Did she have some part of the blame? And they make it so sensationalized. We're talking this particular story. How many times did she go back with the same problem in the hands of a dermatologist who's not a surgeon? So there's a lot of questions here in this particular case as far as recognizing a problem, whether it's a cold intolerance, a mark on the skin. Things can happen. It's in your informed consent. Be aware. Go to somebody who's well trained. That's all I can say.
That's a good point. Yeah, for sure. Because I think as a surgeon, we have a tool in our toolbox to recognize that early and take care of it, right? A lot of these med spas and derms don't have that tool. So they're sending them to us to fix. And they don't necessarily want to do that right away, or maybe recognize it right away, where maybe we're more akin to, hey, wait, something's going on. We need to go fix this because we're the ones that would fix it. So that's a really good point. I didn't even think about, Dr. Glicksman.
And they said that, when it first came apart, we had this since 2009. When it first started happening, the data I heard a couple of years ago was 1 in 4,000 cases, or 1 in 4,000 cycles gets PAH. I don't know if that's true or not. I was a center in Florida where they did send me a bunch of the early cases, and I treated it all successfully with Vaser. The histology of this PAH, or paradoxical adipose hyperplasia, the fat actually looks pretty normal. But I always found that the patients feel very fibrotic. It feels really tight. And when I've tried to do this with regular liposuction, it didn't work. I've always pulled out the Vaser, which vibrates at a high frequency and seems to melt the fat, and does pretty well. I've actually done some secondary cases where they attempted regular lipo first and it didn't work. And we've done well with Vaser. So that seems to work, but we still don't know why it happens, or really the real number is. And maybe there are a bunch of cases that don't even report it. But the company does stand behind it. They will pay for the procedure to fix it, which has been pretty good. And I agree with you, though. Going back to the same doctor for the same problem over and over again, I would have sought a second opinion. So, look, buyer beware, read your paperwork. This does happen, but, we can correct it if it happens, and it's not the end of the world. But I've definitely seen some big areas of hypertrophy, like a lady who just the whole abdomen is filled up with it, but it works pretty good to fix it. The second story that we're going to talk about is interesting is, another one of our Zoom kind of stories that we're all on these Zoom calls and everything else. And, how to fix your neck without a facelift is basically this story is. Like, what else can you do? And, why don't you, Carolyn, why don't you lead us off on this? And Dr. Hustak, Kristi, you can kind of second, and I'll pull up the tail.
So, as far as facelifts and aging of the face and neck, it is one of the things as my breast patients and my body patients age out, they immediately start to focus in on the jowls and their necks. And there's so many options now, they're non-surgical. So, I do have, now that I no longer perform actual facelift surgeries, I did for 25, almost 30 years, but there's so many other options, from melting away the fat with Kybella, different products that dissolve the fat, to the CoolSculpting that we talked about a little bit. But there are smaller hand pieces that people do, so there's options for fat removal. That's one problem to clean up and straighten up the jawline, but that's not a skin issue. And when you get into skin issues, then you got to sort of shift over to either, if you're not using some fillers to contour, that's just sort of like smoke and mirrors. And I always tell my patients, you're just renting those fillers because they come and they go, they come and they go.
That's good. I like that. Can I steal that from you?
Yeah, I tell them, you're just renting this. It comes, it goes, but eventually you want to own something. And that's where I got to shift over to the two of you who are a little bit more into working with the actual surgical procedures, the lifts, and what maybe you can
do you have any tightening devices in your office, Carolyn?
Just what I just bought, but I only bought the Hero handpiece. I did not buy the Halo.
Stuff.
So I don't buy. I don't do any
they're more color and stuff and more tightening. But how about you, Kristi?
We do. We have some non-surgical devices. So we have some radio frequency devices. We were early users of the Thermi technology and have shifted more to the body tie in mode technology. We have a beautiful Cyton laser too. It just like anywhere in the face, you got to address all the layers. So that's kind of the crepiness of the skin. That's some of the dermal tightening, some of the muscle work that we can do with fillers, and then obviously the fat too. So I think, there are a lot of bridge procedures, which is fantastic. So we can do some, kind of skin tightening. We can maybe even do some fillers in our chin. We can take care of some of those platysmal bands and kind of stave off maybe potentially the need for a more aggressive facelift, 10, 15 years down the road. It's not going to replace it, but I think people in my demographic, that kind of 30, 40-year-old, early 50s, we don't necessarily want to jump straight to the facelifts right away. So having options to tighten up that skin with a little skin tightening device is, I think, fantastic and a really nice niche kind of device.
And one of the nice things about going to a plastic surgeon is that we can offer both non-invasive and invasive procedures. Like, I had clinic today. So some of the patients, I said, like one of the last consults, you need a facelift. She was a little older, and not that old, but later 50s, but she had sagging of her jowls and her neck. And I'm like, listen, the only thing that's going to really fix you is a lower facelift. But we also, we were talking a little earlier, I love my Elevate, which is a minimally invasive neck procedure where we do a suture suspension of the neck with or without a little skin excision. And we also have a lot of non-invasive things in our office. Like, I love Soft Waves, which is basically Ulthera, iPhone 13 version of Ulthera is what it is. It's a newer version. I love that device because it doesn't hurt. It's got 7 transducers instead of 1, and it's focused at the skin 1.5 millimeters down. And we do that under topical. So we're doing a lot of that. We also use our radio frequency microneedling devices, the Genius, the Morpheus, for some tightening, kind of transitioning more to the soft waves because it doesn't break the skin and there's no downtime. But I think when you really do your homework, if you go to someone who only has one device, that's all they're going to do. And I think that I like what Carolyn said about the renting the devices versus renting things versus more permanent. And I think that's why they end up coming to us.
Yeah. And I think, one of the things is interesting is that if you are going to somebody who only does, like you said, skin care and machines, and they can't transition you to surgery, I think that's when you see the scary looking person with a face full of filler. You turn around in Whole Foods and you're like, what did that person have in their face? Because that doctor didn't let go. And the fact that I don't do facelifts anymore, it opens it up that I can just say to them, you need a facelift. I'm not looking for money. I'm not doing it, but you are beyond my care anymore. You have too much skin. And when I trained with Gene Curtis, who was a fantastic plastic surgeon years ago up in Boston, and he used to basically say that there's a difference between the quantity of your skin and the quality of your skin. And when you get to the point of there's just so much excess of quantity, then you need one of these procedures. And that's kind of my defining thing for these patients is like, I'm done with filler on you. How much more can you put in and not start to look like a cartoon of yourself, and that's when I send them off to get facelifts someplace. So
listen, there's a lot of stuff out there. Do your homework, do your research before you really embark on these things. And I like what you said, Carolyn, about the Whole Foods, because normally, like, you guys ever see Men in Black where they got all the aliens? That's what I think Whole Foods looks like. It's like I see these people that I think they're definitely from another planet when they're walking around Whole Foods.
Too much. I mean, I've seen like 4 or 5 syringes in the jawline, and you're like, oh, God.
Masks hid a lot of it for many. You take off the mask, and then you just see the lips, and you go, okay, natural isn't what you're looking for.
Yeah.
Okay.
That's wonderful. Alrighty, guys. Well, thank you guys for joining us. If you're looking for any more information, please go to our website at theplasticsurgerychannel.com, and please subscribe to our YouTube channel, The Plastic Surgery Channel. Thank you all, and good night.